I think the vaccine will make a big impression on the pandemic in Europe. Currently, we have currently we have this B117 strain, which has emerged in the southeast of England, and it definitely seems to be more contagious than the strains that we've had previously in the UK. And we've seen our second wave, which was declining quite well, come back with quite a lot of force in the UK at the present time, and it seems that it's doing the same across Europe as well. And of course, we have seen other strains appearing in Australia and other parts of the world too. So we're hoping that the vaccination really will make a big difference to the progress of this particular outbreak at the moment.
Now, do you believe that this new strain is likely to complicate efforts to inoculate people?
It could be, because it definitely seems to be more contagious. The appearance of the strain in southern England from 20th of September, when we had our first case, constituting about 20% of cases by November, and now it's about 70% of cases, could mean that we'll have to vaccinate more people to achieve herd immunity. Normally we have about 60% target for herd immunity. That's calculated on the basis of what we know about the infectiousness of this particular virus. But if the new strain is more infectious, then it means that we will have to vaccinate more people. In the UK, we're planning to vaccinate about 1 million people. We're planning to vaccinate about 1 million people per week, and in fact, we have vaccinated 1 million people in the last 10 days of the outbreak. At the beginning of our campaign. Now, we have 67 million people to vaccinate, so even at 1 million a week, that will take most of 2021 to achieve that. So, by targeting the most severely vulnerable, for instance, there's about 3 million people in the UK that are 80 years old or more. And by targeting those, we hope that we will be able to reduce the mortality impact of the outbreak, even though case rates might remain reasonably high.
Now, with the rollout of these vaccines, some people are touting this as the beginning of the end of COVID in Europe. How does that sit with you now with these latest developments now, particularly this new strain there in Britain?
I think that vaccination is the only real way out of this. We can't rely on natural immunity, because although we probably have in Europe about 25% of people that have recovered from a natural infection and therefore do have natural immunity, if we simply were not to vaccinate, then we would get to natural herd immunity eventually, but the human cost would be enormous. For instance, we have now in the UK had about 800 deaths per million from the virus. Now, that compares with the Australian figure of 36 deaths per million. So we simply have to vaccinate in order to get out of this without the death toll increasing any further.
Now, surveys have been pointing to a high level of hesitancy towards the vaccine in countries like France and Poland. How big an obstacle do you see this being?
Well, some of the surveys have been about 60% to 80% acceptance of the virus. Now, if we have 60% acceptance, then it means that we've still got another possibly another 10% to reach before we reach herd immunity. If the herd immunity target is 65%, at which time the virus won't be able to spread, then 60% acceptance won't be enough, and there still will be some spread of the vaccine, some spread of the virus in the community. However, if we have 80% acceptance, then we ought to be able to get to target on this and bring the pandemic to an end. On the other hand, if the new strain is actually more infectious, which it seems to be, then perhaps that target will be higher, and we still will have isolated cases even after the pandemic as a whole has ended.
And just finally, Dr. Gatherer, there's also been issues with equipment. Germany's campaign had been delayed after concerns that one particular batch wasn't kept at the right temperature. Given the size and the length of this rollout, are there enough resources to ensure that this doesn't keep happening?
The two vaccines that have been approved for use so far, the Moderna and the Pfizer one, do have an issue that they need to be stored at -80. We have another vaccine which may well be approved this week, the AstraZeneca vaccine, which can be stored in a fridge at normal domestic 4 degrees temperature in a fridge. So that has a lot of advantages in terms of the logistics of rolling it out. So consequently, we might well, with that vaccine, not have the same problems we've seen with cold storage of the Pfizer vaccine. Also, it's considerably cheaper. It's about £5 per dose, £5 per dose, which is about a quarter of the cost of the other two vaccines. So, in terms of getting a vaccine out to the whole world, there might be a considerable logistical advantage to the AstraZeneca vaccine over the others. But as yet, it doesn't have approval. While we only have approval for vaccines that need to be stored at -80, then there's always a likelihood that these kind of problems with storage and distribution could occur.
Dr. Derek Gatherer, for your time, thank you very much.
Thank you very much.